Welcome back to Cancer Buzz TV. I'm your host, Summer Johnson. In the past, mantle cell lymphoma has been viewed as incurable. But with early diagnosis, plus new drug options and cellular therapies, better outcomes for patients are possible. As the treatment landscape expands, it's important to be mindful of adverse events. Today, we'll discuss strategies to address and mitigate adverse events in this patient population. Our guests are Dr. Victoria Nachar, a clinical pharmacist specialist in hematology at the University of Michigan Robo Cancer Center in Ann Arbor, and Dr. Karen Fancher, a clinical pharmacy specialist in oncology at the University of Pittsburgh Medical Center at Passavant Hospital. Thank you both for being here. I'll ask both of you, what's your approach to managing adverse events, specifically with relapsed refractory mantle cell lymphoma?
So I think that's a great question. So I'm at a very small community practice. So we have a lot more boots on the ground, if you will, of our general staff. So we strive to keep good communication and open and early communication with all of our patients, but specifically for mantle cell lymphoma. We would do frequent phone calls or frequent check-ins over our portal, depending on what our patients would prefer. And then I think, for the individual agents, we'd tailor that appropriately. But I would stress certainly early and frequent communication in whatever manner the patient prefers.
I think one unique strategy to mitigate some adverse events with CAR T cell therapy are to have really effective bridging strategies. We know that patients who receive CAR T cell therapy with as minimal disease burden have lower risk of adverse events and lower severity of adverse effects. It also helps, of course, with the longevity of the efficacy of the product. And so it's been exciting that in relapsed refractory mantle cell lymphoma, we've had newer therapies that have allowed us to bridge patients better to CAR T cell therapy. I think additionally, a strategy to mitigate some of the adverse effects with CAR T are just early intervention. So the more we give CAR T cell therapies, the better we are at recognizing early signs of cytokine release syndrome and initiating treatment options like tocilizumab and corticosteroids early. And that has really helped to mitigate downstream long-term cytokine release, as well as decrease the severity of the cytokine release or the neurotoxicity that you see.
Dr. Nachar, what adverse event profiles do you typically observe with BTK inhibitors, and how do you address those?
The most common side effects that you see with the BTK inhibitors are your cardiovascular toxicities, hypertension, atrial fibrillation, some bruising or bleeding. Depending upon which agent you're using, you might see some neutropenia or headaches. And then across the board, we do see some fatigue. We manage these, again, according to national standards, keeping in mind, though, the severity, paying attention to drug-drug interactions. So some of the medications used to manage atrial fibrillation might interact with your BTK inhibitor. So making clinical decisions on if those are the best medications to manage the side effects, or do we need to make adjustments to the BTK inhibitor if we're going to do that. Things like hypertension can be managed according to standards, but of course, we need to be paying a close attention to the high blood pressure. If we're not able to manage it, then we need to make decisions on the future of the BTK inhibitor therapy. Similar to headache and neutropenia, we manage those on a case-by-case basis as you would manage those, under any other circumstance. And a lot of the side effects with BTK inhibitors tend to get better over time. I think the most concerning thing would be the cardiovascular toxicities.
Doctors Nachar and Fancher, what would you like to share with your colleagues?
I think there are some unique strategies using electronic resources if patients can be tech savvy. So whether they can use apps to monitor adherence or side effects. We have some cool technology that can link to our electronic medical record that use text message-based responses. where you can ask patients questions about side effects, or you can ask them vital signs, what their blood pressure is, for example. And all they have to do is text a response and it'll automatically populate into the electronic medical record. So those are unique digital and technology-based strategies that I think more to come with, but are being examined for patients receiving these therapies.
So I'm going to give a shout out to my co-speaker here at the University of Michigan. Institutions like Michigan are light years ahead of some of us in terms of patient-friendly communication strategies through technology. So I love what I hear about the apps that they use and the methods that they have. Again, my patients are a little leery of some of that, given the technology issues and elderly patient population. But I think as those institutions kind of perfect and kind of work out the kinks, it's going to trickle down to those of us in the community setting. And I'm really excited to see how we can harness that technology for my patients that aren't quite as tech savvy as maybe some others in different parts of the country.
Thank you to you both. Additional resources can be found in the show notes, as well as information on ACCC's Cancer Diagnostics Initiative. It provides medical professional teams with the precise resources vital to multidisciplinary cancer care. Also, make sure you're following us on your preferred podcast player to stay up to date on the latest in cancer care. Until next time, from all of us here at Cancer Buzz TV, thank you for watching.